Thanks everybody for this opportunity. As Robin said, I'm going to be sharing a few of our early reflections from a project, a Wellcome Trust funded project that is known as the Bate-Papo Vacine. It's a qualitative participatory study that we are conducting in one province in Mozambique to basically try and understand the barriers that are being faced in vaccinating children under the age of 2. So just an overview of the objectives. Those are our 3 main objectives. To understand why the dropout rates, why are we seeing the dropout rates that, that we are seeing, including both before COVID-19 and sort of now in the COVID-19 era, and also to try and identify or formulate some community-driven solutions to improve full immunization for all children below the age of 2.
Bvudzai, sorry to interrupt. Could you possibly put yourself in the full screen mode? Just to make the slides a little bit bigger.
I see. How do I do that?
If you just go to display settings at the top, the middle option at the top.
Okay, yes. And
then switch, swap presenter and slide view.
Right. Is that working?
Yeah.
It is, thanks. And can you see it okay?
Is it fine for everybody?
Yeah, great. Right. Thank you.
Thank you. You never stop to learn with you.
That's right.
Right. So thanks for your patience with that. And then our final objective is to basically draw some lessons in terms of what community-based participatory research methods work. Obviously, before COVID, we had planned to do some human-centered design approaches, but we don't know if we're going to be able to do that as fully as we had hoped for. So there's a potential to, somebody needs to be admitted. Okay. So there's a potential to change some of that as we go forward. And then how are we doing this? So we're using photo voice. I'll speak a little bit more about that in a minute, but we're basically having at least 30 caregivers take pictures that reflect their immunization experience, their children's immunization experience. And then we're also getting information from health workers via SMSs over a period of a month. So we have an SMS service where health workers will be able to send an SMS at least once a day about the experience that they have had. And then finally, the human-centered design approach. For this session, sorry, the slides. So this is just an overview of what we're doing with the photo voice. We get our caregivers, we've trained 6 caregivers and then they go out in force. We've trained them to recruit other caregivers who have children that have dropped out of the immunization program. After they give their consent, they are trained to use the camera, and then they go over a period of 2 days, they can take pictures that represent their child's immunization story. They're given some guiding questions, not leading questions, but just guiding questions that they can use in taking pictures. And that's really them documenting their journey and trying to reflect on why or what were the barriers that led to their children not being fully immunized. What was that experience like? And then after that, the caregiver researcher then meets with the caregiver again, gets the camera back. They do a semi-structured interview where they select 5 photos out of all of the pictures that the caregiver would have taken. and then they discuss them, why those pictures and what are they representing. Okay. So what are some ways that we, how are we listening in this way, given that this is a session on listening? We're hiring caregiver researchers who, for the most part, come from the communities where we are doing research. So they're fairly familiar with the context. They may not know the mothers personally, but at least they have a good understanding of what's happening in that particular context where we are doing this research. And then we're using photo voice. This is actually quite out of our comfort zone. We're used to either doing interviews or using quantitative data. And this is the first time that we are actually using photos as part of our research. We're hoping that through this experience, we can be able to learn, new things that we wouldn't typically learn from the other methodologies that we've been using previously. So this is actually our first time doing it. We just did the pilot 2 weeks ago, and so I'll share a little bit about that before I conclude the presentation, but still quite newbies in this area. And then the caregivers, again, because they come from that area, Mozambique uses Portuguese as a business language, but each of the communities has their own language that they use based on their tribes and so on. And so these caregiver researchers are able to engage in some of the, in those tribal languages. That's just a quotation from Nelson Mandela, where he said that if you talk to a man in a language he understands, that goes to his head. If you talk to him in his language, that goes to his heart. And so this was something, that was very important for us when we were thinking about the caregiver researchers and taking people from the communities where we were doing this research and not bringing trained researchers, coming from the city as we typically do. Why did we take this approach? We really wanted to ground our data collection in the local context, and even our Ministry of Health partners, they also mentioned to us that they are tired, in quotes, of having to just deal with numbers or quantitative data. They really wanted something that could reflect what was really happening, so that whatever solutions are developed after this research can really be grounded in the local context. And so this was one of the ways in which we thought we could do this. And some of the benefits, we are hearing from our caregiver researchers that, they're really enjoying the experience, they're able to be empowered as well. But even as they interact with their fellow caregivers, they're able to listen with understanding because they know where these caregivers are coming from. It was a mental shift for us as an organization as well, just because we are used to doing research in a different manner. And now to use this particular approach has been quite different. We've had to shift how we do our hiring. We've had to also have the right budget to be able to do this, because it's not the cheapest. It's important, but it's not the cheapest when you compare it with other ways of collecting data. Okay, so right, slides are a bit slow. So what kind of data? So this was from our pilot, so by no means comprehensive, just some early lessons that we're getting that we got from our pilot. And by the way, we got ethical consent from these caregivers to use the pictures as well. So when you look at the photo at the top, the caregiver was saying, for them, that picture represents, you know, a child who doesn't have any problems with walking because she's been vaccinated. When you look at the other pictures, interestingly, there were quite a number of caregivers who spoke about the sacrifice that they have to do in order to be able to actually get to the health facility to get their children vaccinated. You will see two of them mentioning things that have to do with housework, or, you know, the one caregiver saying when she got home, the child was crying, but then the husband had done at least some of the house chores. So those are some of the things that are very important, you know, for caregivers that determine whether or not they're able to go to the health facility. But you also see a fair deal of satisfaction from some of the mothers in terms of them believing that actually once a child gets their vaccines, then, you know, they'll be fine, they won't get sick and so on. In the last picture, the mother took a picture of the child playing while they were waiting for another neighbor, because the health facility is so far away and it's often not safe, so they go in groups. So these are just some of the experiences that we've gathered so far. And we have more that's coming in this week as the data collection is progressing. But we really think overall that using photos as a way of listening is both interesting and useful, because when the caregivers take the cameras home over 2 days, it really gives them time to reflect on their experience. So it's not as rushed as what you usually get from your typical interviews, where people answer sort of in a rush. So those are some of our early experiences, and we're certainly looking forward to learning more and sharing with this group and with others. Thank you.
Thanks a lot for a great presentation. I'd like to invite our participants to do turn your videos back on, and feel free to raise your hand to ask a question or add something into the chat, or indeed use the virtual hand function if you prefer. Can you unshare your screen there, Bvudzai, for us? Thank you. So yeah, questions, reflections, anyone?
And even suggestions, if there's anybody who's done this before.
I think there's definitely a number of people who have used Photo Voice on the call. Yeah, so add something in the chat, raise a virtual hand, or give us a wave. Can't see everybody. We've got Al there, so Al, go ahead.
Hi, thanks for that. That was really very, very interesting. Did you find that the method Photo Voice added something that you wouldn't have got from doing from doing, you know, focus group discussions or interviews? Did it enable you to listen to different types of problems, maybe?
Good question. Like I said, this is still early for us. So I'm only speaking from what we got from the pilot. Obviously, we may have more once we have more data coming in. But I think for me, so far, what I've picked up, I think some of the methodologies, they do work, but in a sense, they're quite patronizing, depending on, you know, how you see them. When you give somebody a camera to go home, which was something that we really thought about in terms of security and all of the things, but when you give somebody a camera to go home, in a way you're trusting them to go, and then you're also giving them an opportunity to really go and think and reflect on their experience. And I think for me, that's been the richness of it so far, is their ability to have that opportunity to really think through their experience, and then take a couple of photos and then choose sort of one on a few that they feel kind of represent their experience the best. As to whether a focus group would have given us the same, I don't know. But I still feel that there's a level of empowerment that comes with the methodology. And also some of the, in fact, yesterday I was talking to one of my colleagues and she said that one of the interviews that just came in made her cry, but I don't have the details just yet. But I think what I can get from that is that there's a level of deep reflection that goes into that. And I think for us, when we're also going to be able to map out all these pictures, we're going to have quite a strong message or a useful message from the pictures.